Antibiotic-resistant infections are one of the biggest challenges facing healthcare systems around the globe. And this is not a problem for the future. This is a problem now. Drug-resistant infections kill 700,000 people a year worldwide, and some of the leading researchers in this field are gathering in Brisbane this week to try and find some solutions. Among them is Professor Dame Sally Davies. She's the Chief Medical Officer for England, and she's in our breakfast studio. Sally Davies, welcome to RM Breakfast.
Thank you. Good to be here.
For years now, we have been hearing about the rise of antibiotic-resistant superbugs. We've had warnings about it. Right now, in 2017, just how serious is this problem?
Well, it's very serious and it gets worse all the time. We know already that there are people dying because they have drug-resistant infections, and that the way many of us use antibiotics is making this worse day by day. And it's not just a problem of the developing world. This is a problem in the developed world. So we calculate that in England alone, at least 5,000 deaths a year are drug-resistant infections. So this is here. It's going to get worse.
I have seen another statistic that paints an even more bleak picture than that in the UK, and perhaps this is wrong given the stat you gave me. It said at least 12,000 people die from antibiotic-resistant bugs every year, more deaths than breast cancer. Now, to be even, whatever the stat is, to be even close to the deaths from a prevalent cancer like breast cancer is phenomenally frightening, really, isn't it?
It's shocking, and it's a hidden issue because most people don't realise what's going on. They know they died of their relative died of infection, but somehow it's invisible and people don't start talking about, well, in the old days we could have treated this, but not now. So there isn't the outcry of horror that there should be to protect modern medicine, because if we don't have antibiotics, we will lose modern medicine.
So this is, let's be clear, because I think I've seen so many documentaries and programs, and yet when it's written this starkly, I finally got it. Things we once could have cured, we are now no longer curing in some people. Is that right? Or fixing?
Well, already there are people. Yes, I can give you, for instance, a personal story of one of my patients who had a replacement hip. He got a drug-resistant infection in it. He lost that hip. He ended up walking round without a hip, well, limping round without a hip. Luckily, he didn't die because we could take it out. But there are many things where we use antibiotics to save people. So think about cancer treatments. Almost every cancer adds to the poor reaction to infection that we have when we have cancer. Chemotherapy, radiotherapy particularly. So you're beginning to get to a moment where the doctor will be able to say, well, I can give you a treatment that might well cure you, but you will get an infection, and I can't guarantee to cure that. And then take the example of TB. There is now extreme drug-resistant TB, which spreads very easily in the home and from person to person, which is killing people because they need to take 16 tablets a day for 2 years. That's 19,000 tablets. It's expensive. It's difficult. This is killing people here and now.
And this is the TB, the drug-resistant TB, is that a problem primarily for the developing world, or is this also creeping back into the developed world?
Well, it's particularly prevalent, clearly, in the developing world, South Africa and everything, but we have a big problem in Eastern Europe, and it spreads into Britain as well. So we get the odd case, and we have basic, simple drug-resistant TB as well. So it is here for all of us now.
And Sally, we've brought this on ourselves, basically, haven't we, through lax use of antibiotics. Tell me about the use of colistin, which is, as I understand it, a last gasp antibiotic, a super antibiotic that is used in farm supplies.
So, yes, we have brought it on ourselves. Two things. We misuse antibiotics and we stopped looking for new ones and making new ones. The colistin story is a very interesting one. The drug was made in the late 40s. It's got nasty toxicity, so it can damage kidneys and livers. So we didn't use it in humans, and it started to be used in animals. But in animals, either to help them grow more, called growth promotion, or just tipped into their feed because it's cheaper than hygiene. And then about 18 months ago, a transposable element of DNA, genetic material, carrying resistance to colistin was found in bugs in China. It's now found across the world. It's called the MCR1 gene, and it just hops between bacteria. It hops into friends and cousins, and then they, as they propagate, can pass it on to their children, grandchildren. So this is very serious, and it's serious because of the resistance. It's serious because as we lose the antibiotics we preferred in humans, we're turning to colistin as a last resort, despite its horrid toxicity, and it doesn't always work.
It's 14 minutes to 7. Our guest is Professor Dame Sally Davies, England's Chief Medical Officer in the country at the moment, with a lot of experts in this area trying to get the world to focus and come up with some solutions to drug-resistant superbugs, basically, antibiotic-resistant diseases. It's pretty frightening, Sally, to finally think that this is no longer something we're just sort of warning against, but it is now. For individuals listening, is it only those who've used masses of antibiotics in their lives that are likely to find themselves in this situation?
No, unfortunately, it could be any of us, and we know that most humans overuse antibiotics. So if I take the UK example, about 1 in 4 antibiotic prescriptions that are given in the community are useful and may work. The other 3 times have been given because the patient feels ill, but it's a virus that won't respond to antibiotics, or it's the wrong antibiotic. So we're grossly overusing them every day. And I expect that Australia's as bad as the UK.
And when you say grossly overusing it, does that mean if you'd had 4 scripts a year or 40 scripts a year?
Even 1 or 2 scripts a year is probably too many and more than is needed.
So the answer is to find new ones. And again, we've been talking about this for a long time. Is this not happening? And who's to blame here? Is it governments not investing? Is it big pharma not investing because there's not money to be made? What is it?
Well, it's a shared societal issue. Government hasn't been investing in the basic science. We in Britain have ramped up the money we're spending dramatically over the last 2-3 years. But the companies thought that they had produced the antibiotics, and as they don't get a big profit from them, they would withdraw from the market. So we're all at fault. So we all have to get back into this and work together for society.
So the World Health Organization now says governments need to invest in research if these drugs are to be found because the market forces haven't responded. So this is a kind of a new directive. From your vantage point as being the Chief Medical Officer for England, do you see this happening? Do you see governments around the globe responding to this?
Yes, governments are beginning to respond, but with very faltering steps and not enough money. We don't want money throwing at this, but we do need to develop the research teams. We do need pharma back in it. But it will need probably some new economic models for how we get pharma into it.
And do we have the expertise and do we have the time? I mean, realistically, Sally, how long would it take for a smart research team to come up with one answer?
There are some drugs around that people can pick up, but they take, on average, drugs 20 years from discovery to get them into practice. We're going to have to speed this up. And sadly, we have an older generation in general interested in this field. So we need to get going quickly so they can teach the young and the young can be innovative and move it forward.
But do we have, in your view, do we have the capacity globally to conquer this, to answer this?
We have to have. So the UN has set up a new interagency coordinating group for really pushing on antimicrobial resistance. I'm honoured to be a member of this, but we have to get this right because people are dying every day because of drug-resistant infections.
Sally Davies, good luck with the challenge. Thank you very much for joining us.
Thank you.
Professor Dame Sally Davies, England's Chief Medical Officer in Brisbane at the moment. There's a global conference of some of the smartest minds looking at this. You're listening to RM Breakfast. It's 6:45.